All right, folks, we're going to present a case here. I have Dr. Rizvi Kim, who is a trained fellowship MSK radiologist. We're going to be going over a very typical case of a patient who fell on an outstretched hand or a foosh injury. This is great for some of our younger colleagues who may be in residency right now and want to know, the typical findings in something like this. So without further information, I'm going to go ahead and pass this on to Woojin, who's going to go over the salient findings in this case. We have a left wrist here with multiple views, very typical views of the left wrist, and we have some post-casting views. So go ahead, Woojin.
Sure. So what you can see on the frontal view here, you can see that there is a disruption of the cortex and a sharp angulation, showing you that there is a fracture through the metaphyseal region of the distal radius. And you can see that there's some, overlapping of the cortex here due to impaction. And you can see the fracture quite well on the lateral view. You can see that the distal fracture fragment is dorsally angulated with respect to the proximal fragment. And then that it is impacted. You can see the piece of the bone overlapping with each other due to the impaction here. And because of that impaction, you can see that there is an acquired positive ulnar variance, meaning that the distal ulna, you can see that it is more located distally. It doesn't quite line up with the distal radius because the radius is foreshortened because of the impaction from the acute fracture. Whenever you look at a fracture, you obviously, the first finding will stick out for you, and you tend to focus on that fracture. But in radiology, there's this concept of satisfaction of search, SOS, which you want to avoid. So what you want to do is, once you find an acute finding like this, you want to look for additional findings and not just be satisfied with the acute fracture. You obviously see the soft tissue swelling, but if you look at the soft tissue swelling, you can see that there is quite a bit of soft tissue swelling on the ulnar aspect of the distal ulna. And if you look really, really carefully, you can see that there is an acute fracture of the ulnar styloid as well. So you can see that there is a combination of the distal radial fracture as well as the distal ulnar fracture here. And then, you can sometimes see, this is called a Colles fracture, whenever you see a distal radial fracture with dorsal angulation of the distal fracture fragment with impaction. You can commonly see the ulnar styloid being fractured, but also the carpal bones could be fractured as well. So you definitely want to see any types of disruption of the carpal bones here, which I don't really see. And then on the right, you can see that this patient's been casted since then, and they tried to reduce it as much as possible. So you can see that the angulation, you don't see that sharp dorsal angulation here, as you saw previously, and also that you can see that the what you saw previously, the positive ulnar variance, you don't quite see it. You can see it nicely lined up with the distal radial margin because they reduced this. So they reduce the fracture as much as they can with the casting. So this is a classic distal. This is classic Colles fracture. Typically happens to patients who fall on an outstretched arm.
Fantastic. Thank you, Dr. Rizvi Kim. This has been a great session for us. We've been doing this all in VR right now, being immersed in this environment. We have a full radiology workstation and work suite here, and we can very quickly and very collaboratively go over a case like me and Dr. Rizvi Kim just did. So thank you very much, and we appreciate it.
Experience the benefits of immersive collaboration with SieVRt, a better way to collaborate for medical imaging.